Good morning and thank you for joining today's event. A reminder to reporters on the line, please press star 1 to enter the queue. You will be limited to one question and one follow-up. With that, I will now hand it over to Minister of Mental Health and Addictions, Sheila Malcolmson.
Good morning. I'm honored to be joining you from the traditional territory of the Songhees and Esquimalt First Nations, sending strength to those affected by the revelations at the sites of former residential schools, also those in the interior battling forest fires. Our thoughts are with you, and we're sending you strength. Here today to talk about a serious, treatable, and often misunderstood mental illness, I am very pleased to be joined by Phaedra Aldridge, CEO of the BC Schizophrenia Society, Dr. Diane Fredrickson, psychiatrist at Vancouver Coastal Health, Tracy Windsor, alumni council with the early psychosis intervention team. Up to 1 in 30 British Columbians from all walks of life will experience psychosis at some point in their lives. Many people and their families have told me that living with psychosis is a constant challenge. They encounter stigma and confusion about their illness, which can prevent people from accessing the care that they need. Getting treatment early can have huge benefits and it can vastly improve the life of young people. I have deep appreciation for the work of care providers, the community partners, and for the families who care for those suffering mental illness. They've told me that we need a mental health system that provides early supports to people experiencing serious mental illness, and I couldn't agree more. And that is why we are here today. As part of Budget 2021, our government is investing $53 million for early psychosis intervention. This will expand much needed supports early on and help young people and their families thrive. This means families across BC will have better access to the services and supports that they and their loved ones need. This new 3-year funding will expand programs and increase access to treatment, adding approximately 100 new positions province-wide dedicated to early psychosis intervention. The new positions will boost capacity at 10 specialized early psychosis intervention programs to support more young people on their wellness and recovery journey. I'm honored to serve as BC's Minister of Mental Health and Addictions, and I have a strong foundation for the work ahead of me. The Pathway to Hope is our province's plan, creating that roadmap to recovery, creating that seamless and integrated mental health and addictions treatment system that everybody in British Columbia deserves. Budget 2021 in April made an unprecedented $500 million investment in new mental health and addictions care, the largest ever investment in British Columbia's history. This budget will rapidly advance our journey to realize the vision laid out in Pathway to Hope and the ambitious mandate that Premier Horgan has given me. We are laying the groundwork to make sure people can access effective and culturally safe care. These are the supports that they need on their mental health and addictions wellness journey. For example, last Thursday, we announced a new expanded prescribed safer supply program. This is a first in Canada to intervene to help separate people from the increasingly toxic drug supply. This expands the program that we stood up in March of last year. Also last week, we launched a new training program, a new curriculum developed by and for people with lived and living experience, part of our government's recognition that peer support is an essential part of addictions and mental health care delivery. And this past spring, we gave funding to the BC Schizophrenia Society to expand the vital supports for families with loved ones experiencing serious mental illness. These are just a few of the most recent actions our government has taken to build that system of care that British Columbians need and deserve. My hope is, despite the very hard year that we have had and the hits that everybody has taken to their mental health, that people will take heart in knowing that there is a brighter future on the horizon. I'm confident that with the continued efforts of our care providers, families, people with lived experience, and our community partners, together we will get there. I now welcome Phaedra Aldridge, CEO of the BC Schizophrenia Society, to bring a few words to this announcement today. Thank you, Phaedra.
Thank you, Minister Malcolmson. It is an honor and a pleasure to be able to join you today from the ancestral and unceded territories of the Musqueam, Tsleil-Waututh, and Squamish peoples. Early psychosis intervention is essential. EPI provides evidence-based interventions and supports to individuals and family members of those affected by psychosis. This fits perfectly into the mandate of the BC Schizophrenia Society, which is to support families affected by schizophrenia and other mental illnesses within our province. And I am delighted to see that the Ministry of Mental Health and Addictions is making it a priority to fund services and resources like EPI, which is vital to ensuring that an adequate and timely response to serious mental illness is possible. Research has shown that intervention during the early stages of psychosis reduces the long-term effects. By providing care and treatment early, it helps protect a person's brain from the damage that may occur as a result of continued psychosis. In other words, the sooner we can treat people, the better the long-term outcome will be. We know that no person is an island, that it takes a community of healthcare professionals, caregivers, and family to support people in crisis. EPI involves families in many ways, from providing at least 10 hours of education about psychosis during the initial assessment, to including them in the treatment and relapse prevention plans. And the EPI Advanced Practice works to ensure that this standard to involve families is maintained across the province. By investing in programs and services like the Early Psychosis Intervention Program and the BC Schizophrenia Society, the Ministry of Mental Health and Addictions is showing its commitment to supporting people impacted by serious mental illness. Thank you for helping to ensure that individuals and families across our entire province have access to these essential services and supports that not only increase awareness and challenge misinformation, but also changes lives. Thank you.
Thank you so much, Phaedra, and to BC Schizophrenia Society for all the life-saving work, the vital support work that you provide to British Columbians suffering psychosis and their families. We will now hear from Dr. Diane Fredrickson, psychiatrist with Vancouver Coastal Health. Welcome, Diane.
Thank you very much, and I'm honored to be here today. As a psychiatrist, I provide treatment and support to people experiencing psychosis and related conditions. Early intervention is a vital tool to improve the lives of youth and young adults living with psychosis-related illnesses. Psychosis can be treated using medication and other biological treatments, together with psychological and social therapies, depending on a person's needs. The goals of early psychosis intervention include treating and managing symptoms, supporting a person's goals around recreation, work, and school, and helping to foster healthy support systems. Education about psychosis and involving positive supports such as families and loved ones in the circle of care are often important parts of the recovery process. The funding announced today will help more people get help earlier, providing treatment and support early on in a young person's illness to optimize recovery.
Thank you so much, Dr. Fredrickson, and thank you again for reinforcing the deep benefit of early intervention, that if we get supports to people early on in their diagnosis, we really can transform lives, and that may have a lifetime of impact. So we're grateful for your work and for standing with us today. We're now honored to hear from Tracy Windsor, who's part of the Alumni Council with the Early Psychosis Intervention Program. Thank you, Tracy.
When I was referred to an early psychosis intervention program, I had just been through the most confusing experience of my life. My early psychosis clinician and psychiatrist helped me understand what had happened. I'd experienced an episode of psychosis. While it was at first difficult for me to open up about what I had been experiencing, the early psychosis intervention team provided me with unwavering support from the beginning. Over the course of my 4 years with the program, the early psychosis team empowered me with a foundation of tools, resources, and skills that I needed to build the meaningful and fulfilling life I live today. I am so thrilled that more people will now be able to benefit from an early psychosis program in the way that I did. Thank you.
Thank you so much, Tracy. Really appreciate you sharing your story and reminding people of what can happen when you reach out for support. And I'm so glad that we are bringing extra support. I'm also really glad to see your dog's tail wagging on the screen. It's so good. This year of Zoom meetings, we have all got to see each other's pets, and I know my dog is a real support in my work. Thank you, all three of you, or all four of you, for joining us to mark this really important day. It's such a significant investment. I'm so proud to be part of a government that is investing so deeply in people. With thanks for your lending your voices to the announcement, we'll now take questions from the media.
Thank you very much. A reminder to reporters on the line, please press *1 to enter the queue. You will be limited to one question and one follow-up. And to Minister and our speakers, it appears that you have answered all the questions ahead of time, so we can conclude. I believe we're going to end with a photograph if all of our speakers could hang on the line.
Great. Thank you so much for being here, and I'll now take direction from the photographer.